afternoon, ladies and gentlemen. Alright, today we are going to continue with studies on researches that has been highlighted in the Ganoderma magazine. This time we're talking about issue 96. Alright, next one. Alright, this one is talking about Lingzhi is able to improve the metabolic function and antioxidant capacity in gestational diabetes. Right? Okay, introduction. Next page. Yeah, I mean, normally we come across when we share with our pregnant ladies or ladies who are prepared to be pregnant. We are normally faced with questions like, can pregnant women eat Lingzhi? Or can pregnant women with gestational diabetes take Lingzhi to improve metabolism? Right, we always face with these questions. All right, a study by the research team in Brazil, maybe it's worth for us to consider. An exploratory study by the research team from Sao Paolo, Brazil, may be worth us to explore. Their study was published in the Antioxidant titled Ganoderma lucidum, Modulates Glucose, Lipid Peroxidation, and Hepatic Metabolism in can you hear me? Streptozotocin-induced diabetic pregnant rats. Okay. Next, before we continue, we talk about a little bit about gestational diabetes. All right, gestational diabetes, in short, GDM, is actually in full is gestational diabetes mellitus or something like that. Is diabetes diagnosed for the first time during pregnancy? There has a high glucose level in the body, which will affect the pregnancy and the baby if it is not treated. All right, gestational diabetes is one of the typical 3 types of diabetes. The other 2 are the type 1 diabetes and the type 2 diabetes. All right, type 1 diabetes is where insulins are not being produced. Type 2 are diabetes where it is resistant to insulin. All right, the causes of this gestational diabetes is unknown, but probably due to hormonal changes during pregnancy. Some of them are hearsay because the baby is pressing on the pancreas and the pancreas is not producing properly. So that could be the reason, but as it is, scientifically it is said that it is due to hormonal changes during pregnancy. So it results in the insulin being insensitive and the pancreatic beta cell not functioning properly. All right. There are typically no symptoms. Right. But being overweight, feeling thirsty, frequent urination, family history of diabetes, or you have a late age pregnancy, like people in the from mid-30s onward, are some of the risks that you will face. All right, but not only mid-30s, people in the 20s or 30s also commonly come across. All right, gestational diabetes increase the risk of fetal loss. All right, people with diabetes, they tend to lose the baby. Complication at birth, like fetal pelvic presentation. I mean, what is this? This fetal pelvic presentation is that when the baby is born, it's not in the normal, when the baby is ready to be born, it's not in the normal position of head coming out first. Maybe the leg come out first or sideways, all that kind of thing. Congenital malfunctions, premature birth, macrosomic fetus, large babies, like maybe 9 kilo, and was it 9 grams or 9 kilo, something like that. Very huge baby lah, and then a tendency to develop type 2 diabetes after giving birth in the future. All right, so untreated gestational diabetes also will likely cause high blood pressure because it affects the lining of the blood vessel. All right, so it may, at a later date, may cause hypertension. All right, people with like type 1 and type 2 diabetes also run a very high risk of birth problem. Like especially if you have type 1 diabetes, you tend to lose baby at around 5 months. All right, so that's it. That's why they talk about premature birth, or even 7 months they already give birth. All right, these are all type 1, type 2 problems. But gestational diabetes is, like I said, first time during pregnancy can also have this problem. People with type 1 and type 2 will have this problem. All right, next. All right, gestational diabetes affects the womb environment, and thus, of course, it affects the development of the baby in the womb, fetal development. All right. So after birth complication, it can be a lack of oxygen, right? As just now I mentioned, where there could be a congenital malfunction. That means that the lung may not be that well developed, right? And because of the high blood sugar, when the baby is born, they tend to be low in blood sugar, and it becomes a problem. Jaundice, and easily get infected. Bacterial infection, because they tend to be huge baby and they tend to be not going by natural birth, and tend to be have C-section. All right, and of course we have this respiratory distress system and birth trauma, all that. Right. Now, then treatment of gestational diabetes by the doctor are normally they'll try to ask you to control your diet, exercise. Diet, like they probably tell you to ask you to take more fruits and vegetables, less meat. I mean, in Songho we also always talk about soya protein, nutritional fiber, all that. All this will help you to control the diabetes. So, but of course, if we fail to control, then insulin has to be used, right? In order to control the sugar level in the body, right? But of course, as this is a gestational diabetes, after you give birth, normally you're supposed to go back to normal, but about half of them may go on to develop type 2 diabetes because they gain weight, that kind of thing. Right. Lingzhi has been used in East Asia to control blood glucose level. So therefore, the study thinks that maybe it may help in the maternal glucose metabolism. All right, next page. All right, we look at the study. All right, first, what are the methods? We don't go detail into the materials and methods completely. We just talk a little bit here. All right, so as it is, the study wants to investigate the effects of Lingzhi on maternal glucose metabolism, the biochemical parameter, and the oxidative stress, and the fetal development parameters in pregnant rats with streptozotocin STZ, in short, induced GDM. This is a STZ is a common chemical used to stimulate diabetes in a research environment. This STZ use will damage the pancreatic beta cell. All right, so as a result, it will cause insulin problem, secretion problem. That's why it's normally used as a chemical to stimulate diabetes. All right, they use Lingzhi and its fruit body, and it's extracted, and it contains polysaccharide, polyphenol, carotenoid, all that. What we have been always hear about. What are the contents in Lingzhi? All right, they will use pregnant rats and randomly divide them into 4 groups. One group is the normal pregnant group without any treatment. 2 is the pregnant rat but stimulated with STZ to cause, induced with STZ to cause diabetes from the 8th day onward. And then that is normal lah. Then group 3 will be pregnant rats that have been induced to cause diabetes, and at the same time fed with Lingzhi from the 9th day onward. And 1 day after it has been still induced. Then group 4 will be pregnant rats from day 1. The moment they detect that the rat is pregnant, they will feed them with Lingzhi from day 1 till day 19. That's the final day where the rats are about to give birth. All right, and at the same time, on the 8th day, it has been induced to cause diabetes. The purpose of this 4th group is to show you that if you have been eating Lingzhi before pregnancy or straight away after pregnancy, what will happen? Whereas group 3, the GMD plus GLA, is the one after you have diabetes, you take Lingzhi. All right, so this is the difference between group 3 and group 4 is like that. Okay, let's then look at the result. The result of the this test. First, they do an oral glucose tolerance test. I mean, this is typical of diabetes. If you are diabetic, you go to the doctor, they normally give you some glucose and want to test how your body metabolize the glucose or how your body clear the glucose. Okay, so this oral glucose test was done on all those rats that have been induced, right, on the 17th day of pregnancy. That means it's about 2 days before the final experiment. Okay, the 3 groups that had been induced with pregnancy show high glycemic level as compared to the control. So you can see that the moment they do the oral glucose test, 20 minutes later, if you look at the chart, the left chart, straight away the glucose level shoot up. All right, the one at the low end is the normal one. The normal pregnancy where it has not been there's no oral glucose test. Whereas the 3 is shoot up. All right, but after 20 minutes and 30 minutes, you see that group 3 and group 4, the glucose level start to come down. I draw in circle rectangle in red the part where you need to look at it. You see the induced pregnant rats that has not been treated, the glucose level stay high, right? The one on top. Whereas the groups that have consumed Lingzhi, whether before inducement or after inducement, their glucose level has come down. All right. So what this chart here tells you is that Lingzhi helps to reduce the glycemic response when you are suddenly faced with a glucose low, right? Suddenly faced with a high sugar level. So what it tells you? It tells you that Lingzhi can modulate the severity of the spikes in glucose, and diet fluctuation. So this, if you change it into a bar chart form, you look at it on the right, the bar chart. Okay, so you can see that the first one, the first group, where the insulin level is normal, whereas when it is induced, the insulin level all drops. All right, but when the glucose level, you can see that the one actually after where it takes the Lingzhi right from the start, it has lowered the glucose level lower. All right, the black color bar chart. This is the group that takes Lingzhi from day one. The moment it's pregnant, you take Lingzhi. You can see that it has lowered the glucose level. Okay, this is the bar chart recommendation now. All right, next time we look at the second part here. Result number 2. All right. The next metabolism they want to look at in the body of the rats, because this is an in vivo experiment. About you can see that in liver metabolism, when there is a damage to the liver, in the blood of the in our blood, the ALT and the AST level will go up, because these are the two enzymes that are secreted by the liver, and when there are liver damages, they will go up. So if you look at the chart here, the first one, the A, the top left, you can see that after it has been induced with STZ, right, there is a damage to the liver, whereas the Lingzhi, whether before or after inducement, it has lowered the enzyme level. All right, you can see that from the chart here on the top left, the top left one, the top left chart. All right, because it's a little bit small. There's not much of a difference to the kidney, right? Now, then also the group show that exposed to Lingzhi show a reduction in this enzyme. All right, at the same time, in pregnancy, the fat metabolism, lipid metabolism, the fat metabolism changes because of the maternal and fetal energy needs. Because it's natural to be a little bit fat, all right, when one is pregnant. You cannot be very skinny, because you need some fat for energy and for the baby. That's why you need to increase, but no need to be so much. Of course, also cannot be completely to be so skinny lah, right? But so you look at the bottom chart here, you can see that Lingzhi is able to reduce the triglyceride level. Alright, when administered after the fetal implantation. Alright, so especially more so of the consumption before inducement. Okay, so this tell you that Lingzhi protects the liver from any potential damage that can be caused by the spike in glucose. Right? Okay, result number 3. Next page, Xin Dong. Hyperglycemia or high sugar level during pregnancy generate oxidative stress in the womb and triggers congenital malfunction in the DNA of offspring. Right? I mentioned just now a little bit of the congenital malfunction and the DNA of the offspring, right? So this catalase, GPX, DSH, P-bar, they are all measure of oxidative stress. All right, one is increased, one is removed. All right. So if you look at the chart on the right, in diabetic rats, right, all has dropped. But of course, when it is diabetic, the oxidative stress level increase. That's why they all drop compared to the normal rats, pregnant rats, right? But when it comes to the oxidative stress measurement, you notice that Lingzhi improve the GPX, right? The chart, the left chart here, and the T-bars, they reduce it, right? All these are signs that if during pregnant and they are supplemented with Lingzhi, the oxidative stress level will be reduced. All right, I'm getting a little bit tongue-tied. Okay, this suggests that Lingzhi may improve the pathological condition of diabetes, right? Inhibiting lipid peroxidation and at the same time reduce any potential damage induced by oxidative stress. Right, this DNA damages and congenital malfunction can be a problem. People with type 1 diabetes and type 2 diabetes, if they are not controlling their diabetes properly, the baby born may have kidney damage. Maybe the baby is smaller than usual, or like what we're going to see in the next one, result number 4. Next page here now, result number 4. We look at the part on ovaries and the uterus. All right, the womb and the ovaries. Lingzhi cannot lower the blood sugar as it is in the experiment. Of course, once you are diabetic, you can only have to control, modulate, but you cannot lower completely. It will still be there, right? But in this experiment, they noticed that the weight of the uterus and the more of the uterus than the ovary. Ovary not much of an effect, right? The weight of the uterus, the womb, if it is a diabetic, it has declined significantly, right? From 44 normal to 35, right, grams. Whereas if they have supplemented themselves with Lingzhi, You see that the uterus weight is a little bit better, closer to the normal minds. Alright, what this tells you is that in the case of this rats, they find out that the number of baby rats or fetal mice that survive are higher. The measurement of the head and the circumference and plus the body length and tail are better, right, than those not supplemented. So this technically improve the survival rate and the health rate of the offspring of those who are diabetic and supplemented with Lingzhi. All right, if they have not supplemented with Lingzhi, imagine their body circumference, head circumference may be lower, right? Yeah, and that's why we look at the next one, the result number 5, where they measure the head circumference. They look at the skull. Result number 5. Next one. Okay. Just now I mentioned about causing DNA damage, right? So you have gestational diabetes responsible for causing substantial damage to the fetal brain. So the brain is lower, right? The brain on this one, right? There's a problem. Okay, now when you have a high sugar level in during pregnancy, right, it may cause substantial damage to the brain of the offspring. All right, and this will cause a fall in the neuronal cell. The number of neurons in the brain, in the hippocampus, that result in smaller brain. I remember in Brazil they have this Zika virus that caused by mosquito, where it caused the brain to be very small of baby. The baby to have very small head circumference. Right, this will affect the intelligence of the child. Right, hippocampus is the part where it's responsible for learning and memory. Okay, so when we give birth to baby, what they do, they always measure the circumference of the head of the baby, right? The length of the baby. They want to check if the circumference of the baby, of the head, is smaller than average. That means it's likely that this baby will not be as intelligent. All right, so that statistic tells you so lah. So as you can see from here, it is found that the hippocampus measurement of the diabetic minds decline. Whereas if they have been supplemented with Lingzhi, it adds a little bit closer, although it cannot reach the normal mind, but it improves, right, to that is closer of it. So what does it tell you? It tells you that it can improve the intelligence. At least it's not that will not have a big learning problem. Coming back to the what I was talking about, where if you have type 1 or type 2 diabetes, where the baby born, because the womb of the mother tends to be smaller, right? Just now the result number 4 tells you that the womb of diabetic mice tend to be lesser, right? So as a result, the baby of these mothers born may be smaller than usual. And if it is smaller than usual, the baby, when it is at birth, let's say 5 grams or what, 5 kilo, below 5 kilo, then they tend to may have run a problem of DNA damage that cause damages to kidney. These are all severe cases, right? So as you can see here, what does it tell you? It tells you that supplementing with Lingzhi, it helps to reduce the DNA damage, right? So when it comes to conclusion, all right, so you can see that gestational diabetes is a health problem, right? That need us to monitor closely because it can potentially cause harm to our offspring and to the pregnant mother, right? After that, postnatal, okay, right? Although Lingzhi cannot completely lower the blood sugar level, the study show that Lingzhi can reduce the sudden spike in glucose and moderate any potential damages. At the same time, it protected the liver cell in a hyperglycemic situation, so that the mother, after giving birth, do not run the risk of having hypertension, right? It reduces the oxidative stress and any potential DNA damages to the fetal environment, right? So we'll end up with, say, so-called baby that is as intelligent as it can be, all right? So this last paragraph, I want to say that although in our study here, although the study of this scientific research is just a exploratory one, right? Exploratory why? Because it's animal research, right? It has yet to go on into clinical research. But Lingzhi has been used in East Asia for centuries. So it is indirectly a kind of clinical research that has been in use. It's just that it's not monitored by a doctor, right? But it has been in use in centuries to regulate our blood glucose level. Of course, regulation of your blood glucose level, you have to supplement it with nutritional fiber, protein, all that kind of thing, right? And on top of that, Lingzhi is free from any adverse side effect, all right? So therefore, when we come to pregnant, it is good that we continue to supplement ourselves with Lingzhi for the sake of our offspring, and also to maintain the health of the mother. Okay? All right, with that, I end my sharing. Thank you.